Hello, my name is Lucy Ruderman, and I'm a master's in public health student at the Gillings School of Global Public Health here at UNC. I'm going to share results from a qualitative study in Kenya that aimed to understand the experiences of women at high risk of HIV when they had sustained access to HIV self-test kits. HIV prevalence among women who sell sex in Kenya is estimated to be 29.3%, but innovations like HIV self-testing hold promise for enhanced prevention through increased testing coverage. HIV self-testing offers privacy and convenience and has high acceptability among priority populations, including females engaged in sex work and transactional sex. Within the context of a matched pair cluster randomized controlled trial, which evaluated the effect of providing women with sustained access to free oral fluid-based HIV self-test kits, we conducted a qualitative study to examine how women use self-tests in their relationships and how this affects sexual decision-making. In-depth interviews were conducted with 32 intervention group participants at 12 and 18 months after study enrollment. Interviews were held in the location and language of the participants' choosing, and then using the 2 time points, we set out to understand women's experiences over time. Participants recognized that HIV self-testing was a helpful tool for HIV prevention, one that could determine when other prevention mechanisms, such as condoms or limiting sexual partners, were necessary. A partner's decision to accept or decline a self-test, as well as the result of his test, helped women discern his HIV risk and decide whether unprotected sex was safe, if condom use was necessary, or when sex should be avoided altogether. For example, a positive self-test result made participants insist upon using condoms during sex. However, others felt that condoms were unnecessary once both she and her sexual partner had negative self-test results. Many of the women would not have been using condoms regardless, in which case use of self-testing allowed them to assess their risk and insist upon condom use or end relationships if their partners tested positive or refused to test. Women perceived that access to self-tests facilitated HIV prevention, demonstrating the value of sustained access to self-testing for women at high risk of HIV infection. Because of the longitudinal nature of this investigation, women described being initially uncomfortable introducing the self-tests, but demonstrated increased self-efficacy over time. Further, women viewed self-testing as a complementary prevention tool to condoms, and they believed self-test kits should be widely available. Ultimately, HIV self-testing is a powerful tool that shifted power dynamics and allowed women to have greater control in HIV prevention, have increased self-efficacy and autonomy, and avoid engaging in behaviors that they considered high risk. These qualitative findings suggest that enhanced availability of self-tests may translate to HIV prevention benefits for women at high risk of HIV infection, which is integral to ending the HIV epidemic, a public health burden carried disproportionately by women. Additionally, this study adds to the fact that we must implement self-care innovations such as HIV self-testing more routinely, particularly considering that the evidence has shown that self-care can suit a wider audience and be conducive for hard-to-reach populations, such as people engaged in sex work. Thank you for listening.